that and start with looking at children's well-being. So I mentioned already briefly about this historical timeline. You know, we're standing on the shoulders of giants. There are 400-500 years of early childhood experience and pioneers, if you like, childhood development theorists behind us who understood a lot of this. They didn't know the science wasn't available to them, but they just knew. They knew what was right for children. So I'll have a little look at some of those. Some of the key research and theory that I've done over the years around emotional well-being and keeping brains happy. And then what do children need? How do we put this theory into practice? So by the end of the session, this little session, we'll have a quick look at some of the key research and theory, a little look at some of the emotional well-being for children and how we can connect some of that key theory into the practice that we do every single day. I think first off, a good place to start is with a definition. What do we mean by well-being? And again, I'm not going to read all of this out. The slides will be there later, but the World Health Organization definition for well-being. And there's some really good clues in here. You know, it's defined as a state of well-being in the complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that gives us some really good clues. You know, it's about physical, mental, social well-being. Again, links right back to those prime areas. It fits really well with what we know in early childhood, and I find that really reassuring that we get this, we understand this, and the fact that the science and the research backs up what we already believe is incredibly reassuring, I think. So some of the key researchers and theories, and there were so many I could have picked from, but starting with Montessori, you know, all about the environment, all about what children do in that environment. Outdoors, the importance of outdoors. The research is it's solid. It's absolutely solid. Is the research about the importance of outdoors? 30 minutes outdoors, whenever you can, makes a huge difference. No matter whether you're a little person or a big person. And Montessori knew that even before the science could prove it. And as she said, I'm not suggesting anything new. And Jill said the same at the beginning. I'm saying again here, we know this, but the science is helping us to understand why. More recently, the Hawke study, the High Achieving White Working Class Boys study from CREC, from Chris Pascal and Tony Bertrand at CREC. If you haven't had a look at that, again, huge website, loads of videos on there, lots of documents that you can have a read of. But their research showed that strong, secure and trusting attachments to key adults is critical to healthy development, resilience and well-being. It's what we do. It's what we do that makes a difference to children. Ferrell Evers, whom many of you will know, just one of the most wonderful speakers. I could listen to Ferrell Evers all day long. When he talks about children in a state of well-being, feel like a fish in water. And if you think about how fish move in water, there's no restrictions, there's no boundaries. And when children are engaged in that absolute awe and wonder play, you see that there too. And then my all-time favourite, anyone who knows me would be very disappointed if I didn't have this one in. Yuri Bronfenbrenner's most famous quote, but it's that middle line. Every child needs at least one adult who's irrationally crazy about them. So important. And we know that. And I'm happy to be that irrationally crazy adult. And I know all of you are too. And that's what makes this exciting. You know, this is, you know, just on that slide, 100 and odd years of people's thoughts. The science is now showing us that being outside, play, relationships and so on makes such a difference, that our brains respond to that at a biological level. In order to learn, brains need to feel safe. Children need adults who join in, who are emotionally supportive and share those wonderful childhood experiences, that awe and wonder. What do children need? So a bit of a recap, really. Experiences supported by the 5 senses, appropriate environments, including access to outdoors, opportunities for supportive physical, social and emotional experiences. So again, linking back to what Phil said about those prime areas being super important, particularly now, particularly at this moment. Adults who are present, who are there in the moment, who join in, who snuggle up with stories. supportive relationships between the adults in their lives. So the adults in the setting, between the adults and home, in their home lives. And then just some questions that I use a lot. Now, I can only say them in this order, but you can do them whichever order you like. But who, what, why, where, when, and how. So as you go into the breakout rooms, there will be some questions in the chat that Jill will explain in a minute for you to have a look at. But just to keep those at the back of your mind, who are we doing this for? Why are we doing it? What is it that we're doing? Who could help? Why do we need to do this stuff? And this should be about the children. It should be about well-being. It should be about supporting each other as staff. And then a question that I ask a lot, if not, why not?